Let's discuss croup, a viral infection that causes inflammation and swelling of the upper airway, leading to a characteristic barking cough and stridor in young children. Here's everything you need to know about croup. Croup, or laryngotracheobronchitis, is a viral infection that affects the upper airway, primarily in children between 6 months and 3 years of age. The infection causes inflammation and swelling of the larynx, trachea, and bronchi, leading to airway obstruction, hoarseness, and difficulty breathing. The term croup refers to the harsh barking cough and upper airway swelling that characterize this illness. In a healthy individual, the upper airway, including the larynx or voice box and trachea or windpipe, is normally open and unobstructed, allowing air to pass freely to the lungs. In croup, the viral infection causes mucosal inflammation and swelling, also called edema, which causes narrowing of the airway. This leads to inspiratory stridor, a high-pitched sound during inhalation, hoarseness, and respiratory distress. Symptoms often worsen at night and can be triggered by crying or agitation. The most common cause of croup is parainfluenza virus, though influenza, RSV, and adenovirus can also cause it. The infection is spread through respiratory droplets, making it common in fall and winter months. Patients experiencing croup often present with a barking cough. When we say barking cough, we mean it kind of sounds like a seal bark. They also present with inspiratory stridor, hoarseness, and respiratory distress. Symptoms may begin with a low-grade fever and mild upper respiratory infection, progressing to worsening cough and difficulty breathing over the next 24 to 48 hours. In severe cases, airway obstruction may lead to cyanosis, retractions, and altered mental status. Here's a quick tip. In some cases, the parents of the patient will tell you that they took their child outside into the cold air, and that this helped their child's symptoms. This is because cold air can help reduce the swelling and make the child feel more comfortable. A key diagnostic feature of croup is the barking cough and inspiratory stridor, which helps differentiate it from other respiratory illnesses such as epiglottitis. To manage croup, keep the child calm, as crying can worsen the airway swelling. Provide supportive care and transport the patient to the hospital. If oxygen is indicated, attempt to give humidified oxygen if possible. For ALS providers, nebulized epinephrine may be administered in severe cases to reduce airway swelling, and dexamethasone, a corticosteroid, can help decrease inflammation. Avoid unnecessary agitation, as increased distress can worsen symptoms. Want to watch the full video? Watch the full video and get so much more with your full access membership by going to howtonremt.com or scanning the on-screen QR code now.